My name is Frank Cordasco. It's great to be with you today to discuss our paper, A Modified Lemaire Lateral Extra-Articular Tenodesis in High-Risk Adolescents Undergoing ACL Reconstruction with Quadriceps Tendon Autograft, 2-year clinical outcomes.
My name is Daniel Green. Briefly, our technique is to take a small sliver of the ITB, amputate it proximally, control it with a stitch, pass it underneath the LCL ligament. We use where this little X is, that's where we place a anchor in a trajectory to avoid the growth plate, so we angle distally. Once the graft is secured to the anchor, we then flip it back over to itself and tie it back to itself with the second limb over the LCL. This typically takes us about 7 to 10 minutes in the operating room.
First, our indications. These are skeletally immature young patients in middle school or early high school. They're typically involved in high-risk competitive activities. Second are those with a previous surgical history. We are concerned about those athletes that have greater than 7 millimeters of anterior translation, a grade 3 pivot shift, recurvatum greater than 10 degrees, or hyperlaxity with a Baton score greater than 4. Those with a large marrow edema pattern suggesting a higher velocity injury with lateral femoral condyle and lateral tibial plateau transchondral fractures. Those with a posterior tibial slope greater than 12 degrees. Those with a notch width index less than 0.22. And a Sagun sign is a relative indication. The outcomes instruments were all satisfactory and significant in nature. The revision rate, it was 0. Now we have to be mindful of the fact that while the mean was a 3.4-year follow-up, the minimum was 2 and the maximum was 7, and we anticipate that we will see failures as we approach the 5-year mark, as other studies have found as well. In conclusion, we would say that this is, we believe, the first study to document that ACL reconstruction and lateral extra-articular tenodesis is safe and effective in skeletally immature athletes.